I'm Kevin Coleman with the Santa Post, and I happen to be here at the Pump House just before a meeting. Can the two of you introduce yourselves and say what's going to be happening here this afternoon?
My name's Kelly. I work at Portsmouth City Health Department I've been there for 4 years. We cover 20 counties of Southeast Ohio under ODH for the HIV and syphilis grant.
And you said you're in Portsmouth?
Yes.
And ODH is Ohio Department of Health?
Correct. Yes.
Okay.
And I'm Rachel Childers, and I'm the navigator. I do events and testing and I don't know, all kinds of stuff along with our grant.
Education.
Yeah, education for HIV and syphilis. So.
And this is for 20 counties in Southern Ohio?
20 counties,
We start
yeah.
at Fayette County is our most west, and then we go along through Chillicothe down to Portsmouth, Adams County, up the river to Marietta, Belmont, Cambridge, and we cover Hocking, Vinton, Noble. We cover 20 counties all the way up that way.
And why are you here in Chillicothe at the Pump House?
We're here to have our quarterly meeting. It's called a T.R.A.A.G meeting, the Rural AIDS Advisory Group. So it's community people that come together, and we talk mainly about what Rachel does, testing, how to get people tested, how to educate, what areas we need to educate on, and what areas we need to educate in.
And you say this is quarterly?
Yes, we do this every 3 months.
So you'll be here again in March?
We move because we cover 20 counties, so we try to go to a different county each meeting.
Okay.
We do tests up here every first Monday of the month at Dirty South, and is it Wednesday?
Every first Wednesday of the month at Ross County Health Department.
Yeah. And that is from 1 to 3. And Dirty South on Monday is 10 to 6.
And it is free service.
Yeah, it's free. So you can come in, it's just a finger stick. And we'll do a rapid on you to see if you're positive or negative.
All right. You said you were at Dirty South?
Yes.
Counseling?
Yes.
Okay, I just spoke to the founder there. He's a part of Cochrane Strong.
Yes, and he should
Cochrane?
be here. He'll be here today as well.
Yeah, he'll be here shortly, actually.
So this is an important effort for you?
It is. I have our numbers for 2025 over here for everyone to look at. We're not seeing as many new HIV cases this year as we have in the past, but we also aren't seeing as much testing. So we're wanting people to get tested. The goal for CDC this year is to make sure 95% of people, they would like to see 100%, but our goal is 95% to know their status, positive or negative for HIV.
Okay. How can people learn more online?
We have a Facebook page, Southeast Prevention. We post on there anytime that we're going to be testing, and any days like World AIDS Day, we will post information as well.
And is this World AIDS Day today?
It is, yes.
How can people learn more about that? I suppose do a search for that?
Yes, do a search. I don't believe it's on CDC currently, but there are pages that are funded by private organizations.
All right. And I think we have a local doctor here who is part of the event today.
Yes.
Can you introduce yourself?
I'm Ellis Frazier, Dr. Ellis Frazier. I'm a family physician who's been in Ross County since May of 1990. I had a primary care physician. They didn't have any infectious disease folks then, and so I came, when I came to the community, I trained at Grant in Columbus, and basically, felt comfortable taking care of people that were HIV positive, and at that time they didn't have that many treatments, and so individuals it was really almost terminal care in 1990 until they did the triple drug regimens in the mid-90s. And I just, used my knowledge and took care of folks and home visits and made sure that people got the best treatments. And thus far, folks have done very, very well. I have patients that I've taken care of for 30 plus years.
And you're with Adena Family Physicians?
Yes, Adena Family Medicine, Piketon.
Piketon.
Yeah, I started off in Chillicothe, but now in Pike County.
All right. Is there anything online that you would recommend people to look at, or a way to find you more easily?
Find me more easily just through the Adena site. through the Adena website. And as far as information on World AIDS Day, there's a lot out there. There's actually even packets on how to form and how to do groups. Unfortunately, this year there's not been that much promotion about World AIDS Day, but well, we hope that as long as a few of us are out there kind of promoting the whole topic of HIV prevention, knowledge, okay, and basically knowing about the treatments that are available.
How is the HIV/AIDS, what are the numbers here in Chillicothe in Southern Ohio compared to perhaps Columbus, the bigger cities?
Oh, I mean, when you look at per population, I mean, they're always wrong because there are a few, I mean, they're like a year behind at the most, but, at one point I had 120 folks that I took care of that are HIV positive that was from Ross County and surrounding counties. And I have patients that, one patient that comes from 3 hours away. They got better health-wise and then were able to, move away, but still maintain their care down here. So when you look at the numbers, obviously we're not an area of high incidence, but, nevertheless, all you need is one or two folks, then that impacts the area, right? Okay, so, the biggest issue now is treatment is prevention, meaning that treating a person actually is a way to diminish spread of the disease, and that's why these folks are here for early detection, treatment, intervention, and then you all do linkage to care, right? They do the linkage to care, and then also too, Portsmouth City has, basically what they call the DIS folks, the folks that go out and when people are positive and bring them into the system, and whether it be the medical system or at least get treatment for that. And as a primary care doc, I get to treat it all.
And your meeting today is more sort of getting together, coordinate, training?
Yeah, we started off with what we call community days, which we sat down and because there's this isolation phenomenon in the rural areas in which people are, no one knows anybody else, but then again, some people do know, but then again, it's hush hush. There are folks that, because I'm a primary care doc, that's what was the key thing. When you come to see me, I may take care of, your grandma, or other relatives, but becoming a family doctor now coming to infectious disease, in which people then question. But again, getting people together to talk about the needs of the area, the needs in our area that I think are totally different from those in urban areas. One, they get more funding, and then two, there's geographic things, transportation, housing. It's big issues that have to impact their health more so than access to medicines. Actually, in Ohio, people have been they have good, I'm going to take these off, have had good access secondary to, ODH's program, Ryan White program. It's well funded, and we pretty much can get folks on medications. And then there's another organization, AIDS Healthcare Foundation out of Columbus, that makes sure people get their treatment. So no one will go untreated, basically once we find out their diagnosis, just getting them into the system, and feel comfortable, because there is that issue that not only the stigma, but trust, that people keep their health status confidential.
All right. And your office is in Waverly?
I'm in Piketon.
Piketon.
Yes.
Okay. Where in Piketon? I'm trying to think of.
Dave's auto thing too, so it's right there, 23 South.
Okay.
It's right off 23 South. 100 Indian Ridge Drive. I'll give you an address. Okay.
All right. Well,
Okay, how about that?
we can find it online.
Yes. You
Any other thoughts?
PrEP. You can always call the health department. We can get you on PrEP. That helps prevent HIV.
And what is that?
Transmission.
PrEP?
Yeah, PrEP. And it's one, you can get a shot or take pill form, so.
So these are what they call pre-exposure medications. So PrEP is basically a treatment to decrease the incidence of transmission for folks that are at risk. So say you have what we call discordant couples, of which one person is positive and the other is not. In order to decrease the transmission rate, one, they have the person that is positive be treated and have non-detectable viral load. The other is take medications that kind of prevent, basically the infection part of HIV. So PrEP, and there's, like she talked about, the T.R.A.A.G, which is an injectable medication every couple months, and then there are other medicines that are, one pill once a day, that kind of help do that prevention, and so those are available, and they're available through ODH, the Ryan White program.
They're for men and women.
Right, for both.
Okay. All right. Well, thank you very much, and I'll let you continue to get ready for your meeting.
All right, thanks.